I'm Alyssa Flanders, and I'm a certified PA. So as a PA, my job responsibilities can vary quite a bit. On any given day, I may be doing skin checks on medical patients or excising skin cancers. I may be doing cosmetic consults and cosmetic procedures, or I may be scrubbed into the OR performing surgery on medical or cosmetic patients. I'm really grateful that I have a supportive network of clinical providers that I work with. So I've got amazing physicians, PA students, other PAs that I collaborate with, consult with when needed, and we all kind of learn from each other. My training as a dermatology PA was actually a little bit unique. When I first started here at SCAR Center, they actually structured my position as a fellowship. While most PAs they graduate from PA school and they're kind of thrown into everything, I was really mentored by the physicians in our practice. So I worked with Dr. Modorsky as a facial plastic surgeon. I got to work with the various Mohs dermatologists in our practice and really be taught how to practice dermatology. I ended up in dermatology a little bit differently than probably a lot of other people. When I was in PA school, I actually was not that interested in dermatology. I think when you're not in the clinic, you don't really realize what you do in a dermatology practice, and it sounds a little bit boring. You're just doing rashes and things like that. But when you actually get into a dermatology practice, you realize that it's extremely procedurally based. You're doing biopsies, excisions, suturing all the time. You're doing cosmetic procedures, injections, lasers, and you're still consulting with patients, prescribing medications, doing kind of all the general medicine that a lot of people want to go into. For me, my first exposure to dermatology was on the patient side. As a teenager, I was extremely self-conscious about having acne breakouts, and it's something that I have struggled with even as I've gotten older. And when I was 20, I had to have an abnormal mole removed from my arm, which was a really overwhelming and scary experience. As a PA, I love that I can relate to these patients and understand that when you have a skin condition, it will affect not only your physical health, but also your mental health a lot of the time. And I love that my role allows me to get to know my patients and really see their improvement both mentally and physically.